Hi, I'm John Soberano. I'm a pulmonologist here at Phelps Health. The story goes that I really wasn't interested in medicine at the very beginning. I'm lucky enough to where I did pretty good in school and could do a lot of different things, science, math, etc. And I think my major hesitation from what, of course, all Asian parents want was that I had this preconception of doctors being holier than thou or having God complexes. So I really avoided it for a long, long time. And then I guess somewhere down the line I figured out I don't have to be that person. Just because you have that perception, it may actually work to your advantage by keeping grounded and not being that. So I ultimately fought and then realized I couldn't fight it anymore, and I was meant to be what I am today. 3 fun things to know about Dr. Soberano. Well, 1, I do like to build Legos in my spare time. I find that it's pretty relaxing. It kind of speaks to maybe some of the engineering side. If you've ever seen how people will tear the things open and organize or build stuff, I will open a bag, I will sort them by color, sort them by size, sort them by every little piece, almost like, I have to imagine it's the engineering mind, and then build them. So that's number 1. Number 2, I'm actually pretty big into martial arts and boxing and things like that. So now you have what some people might consider kids' toys, and then you have a pretty physical sort of self-defense mindset as well. Third, I actually started getting into watch collecting just about a few months ago, and I think that's probably just the engineering mind again. It's a lot of intricate pieces, a lot of stuff working into a precision piece of art more than anything else. Whenever patients come out to see me, I think that I run a danger of giving them too much information. And as much as I kind of mention that to folks, they're actually really appreciative of that, because too often, with all the time constraints and everything else that's going on, they don't seem to get enough information, or there's a little bit of confusion, or there's just a little bit of misinterpretation. So a real understanding of what's going on and exactly what I'm thinking and how I'm thinking it. So the other part to that then is a lot of folks have commented or said that when they talk to me, they know they're getting exactly how it is or what's going on. And it's not that I'm saying, bad news in a really terrible manner or a bad manner, but I'm also not sugarcoating things. I'm trying to represent the reality of the disease process or the situation or condition as much as possible, because otherwise no one can be expected to make the right decision for themselves if they don't know exactly what's going on, exactly the things that we can do about it, and the consequences of each of those decisions. I recognize that approach or practice might not be for everybody, but I think the really important part about it is that it very much is my role as an advisor or an interpreter, as opposed to somebody who just tells you what to do. I'm not somebody who's going to tell you what to do. I am somebody who's going to try to explain things and try to help you make the best decision for yourself.